Welcome to Health Organizers, your digestive system specialist. In our Health Bites, we strive to provide you with just enough information to chew on so that you can understand how to care for your digestive system, also known as your hole in the middle. In this edition of Health Bite, we will discuss diabetes mellitus. Now, diabetes definition is that in this illness, we are not able to properly regulate blood sugar, also known as glucose. Now, there are a couple of different types. There's diabetes type 1, which typically means that your body is not able to produce a hormone called insulin, which is going to serve as a chaperone for blood glucose. Then there's also a type 2, where your body may be able to produce the hormone insulin, but not in sufficient quantities, and or your body produces enough, but the cells and the organs don't respond to it. There's also a type of diabetes called gestational diabetes, in which you can have diabetes due to pregnancy. But we will focus primarily on the first two diabetes types that we discussed. So what are the risk factors for diabetes? In the type 1 diabetes, where the body is not producing enough of the hormone insulin, it could be that the immune system is attacking the pancreas and then not allowing the pancreas to make enough of that hormone. In the type 2 diabetes, where we are perhaps producing enough of the hormone, but just that the cells and the organs don't want to receive it, well, that can be due to an excess of nutrients. So for example, imagine you're in your house on a Saturday afternoon and you have person after person knocking on your door to either try to sell you things or offer you products. Well, initially you may open your door, right, a few times, but then you tire of them and you decide, no, I'm not going to open the door anymore. Well, that is sort of what's happening with diabetes type 2, or in the situation where the body's producing insulin, but the organs and the tissues don't want to receive it. After a while, they just see so much glucose coming all the time, so frequently, that they decide they don't want to take it on anymore. So then what are the symptoms of diabetes? It could be fatigue, because again, we're now not getting enough blood sugar or glucose, so we don't have energy. It can definitely be in latter stages. It can be numbness and tingling in the fingers and in the legs. It can be frequent urination, particularly at night. It can be an increase in hunger, particularly again because we're not getting the nutrients that we need, because glucose or blood sugar gives us energy. And so we have an increase in hunger, desire to eat more often. We can have an increase in thirst. We can have abdominal pain, headaches at times. So there are many different symptoms. As far as the natural therapies go, well, if it's the type of diabetes where we do not have a sufficient production of insulin, then that person will actually need to take insulin. If it is the situation where we have enough insulin, but we are just overwhelmed with the amount of glucose that is coming to our houses or our cells and organs, then in that situation, diet or nutrition will definitely play a very large role, as well as nutritional supplementation. However, be sure to contact us about your individual needs and concerns so that we can address what is best for you. That concludes this edition of Health Bite on diabetes mellitus type 1 and type 2. Please be sure to find us on the web at healthorganizers.net. Follow us on Twitter and like us on Facebook. I'm Dr. Megan Laban, and remember, Health Organizers, working with you to tidy up your health naturally.